I am Ruth McEwen, Advisory Council member serving on the Northwest Senior and Disability Services Advisory Councils. I want to welcome candidates, incumbents, and Advisory Council members to the 2024 Candidate Interview Forum. This program features candidates and incumbents from districts serving Clatsop, Marion, Polk, Tillamook, and Yamhill counties, and is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grant-funded programs. The mission of the Northwest Senior and Disability Service is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide to consumers includes information, assistance, in-home and community-based services, financial and medical help, meal site and home-delivered meals, options counseling, adult protective services, Medicare counseling, and peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to our candidate interviews. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member from the advisory councils, and then candidates will have the opportunity to answer questions which will be timed. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disability.
Hi, my name is Monica Adams. I am a member of the Disability Services Advisory Council at Northwest Senior and Disability Services. Today I'm interviewing Suzanne Bonamici. She's the incumbent and Democratic candidate for U.S. Congressional District 1. We'll be asking Ms. Bonamici questions related to seniors and people with disabilities. Welcome, Ms. Bonamici. Thank you so much for sharing your time with us.
Thank you, Monica. It's great to be with you.
Awesome. To get us started, could you tell us a little bit about what you have done to advocate for seniors and people with disabilities and what your upcoming priorities are for these populations?
Sure. Well, first, I'll tell you just a little bit about myself. We used to work at legal aid, and after my legal aid job, I did consumer protection work, and I learned through that work that really, as a representative, I represent everyone. And certainly, seniors and people with disabilities are often people looking for help, whether it be at legal aid or sometimes victims of scams. So that background brought me to Congress with a look at what policies are going to make the future better for the people I'm honored to represent. And so, specifically for seniors and people with disabilities, I am now a senior member on the Education and Workforce Committee, and that committee has the Older Americans Act. And so, since I got to Congress, I started working on updates to the Older Americans Act, which is really support for seniors, great programs like Meals on Wheels, our long-term care ombudsperson's program, and it is a great, great piece of legislation. And I have been able in my years in Congress to pass two bipartisan updates to make the Older Americans Act work better. I also, on the Education Committee, am very committed to someday reaching the full funding for IDEA, the Individuals with Disabilities Education Act. That law is so important because students with disabilities deserve to have an education that meets their needs and prepares them for the future. And the IDEA is a really important part of that. Protecting Medicare and Social Security, of course, access to healthcare and affordable healthcare and affordable housing. And also, I've been focusing on specifically on the needs of LGBTQ plus seniors because I've spoken with many people who are in that community and concerned, for example, if they want to get in home care, that they'll be discriminated against, have to hide who they are to get in home care. So I've been working on that specific issue as well. So that's just a short list of some of the things that I've been working on for seniors and people with disabilities, and they continue to be my priorities. The Older Americans Act is always in need of enforcement and updating, but also with attacks on Medicare and Social Security, I'm very concerned about those as well. So protecting those programs, expanding those programs, protecting people from discrimination. I also work on a bill called the Protecting Older Workers Against Discrimination Act.
That's wonderful to hear. And you mentioned the Older Americans Act several times. We know here that it provides very critical programs for older adults in Oregon. How are you
Absolutely.
planning to protect and continue to increase funding for the act and for other aging and people with disability programs for FY 25-26?
That's also something that I've been working on. I mentioned I led a couple of bipartisan updates to the Older Americans Act most recently in 2020. And so it's still 2024, but it's almost 2025. So I am constantly looking at how we can improve that program. Of course, with the pandemic, we had a lot of challenges with caregiving and that kind of thing. But I'm constantly looking at that. But also, funding is really critical to that. So in Congress, the funding comes from our appropriations process, and I always lead the appropriations letter annually. Where we tell the people who are making the decisions about how much money goes to these programs. So I lead the letter for the Older Americans Act Title III funding, and that is a really important part of the bill because it's funding for home and community-based services, congregate and home delivered nutrition programs like Meals on Wheels, evidence-based health promotion and disease prevention, and also a really important one that means a lot to me is the National Family Caregiver Support Program. And I know from helping to take care of my mom in her final years, she had dementia and then Alzheimer's. Caregivers do so much and they really need to have support. So that's a really important part of that bill. So I lead the effort to fund those really critical programs under it's called Title III of the Older Americans Act.
That is wonderful that so much is going on and you're doing that work. You'd mentioned food and nutrition a little bit. How are you planning to address food and nutrition insecurities for seniors and people with disabilities?
Well, and that is a really important issue too, because there's still a lot of food insecurity here in Northwest Oregon, but also across the country. As we are debating, it's called the Farm Bill. That's where SNAP, this Supplemental Nutrition Assistance Program, is always fighting against proposed cuts to that program. I've mentioned Meals on Wheels already, but I do want to mention too, I know it's not necessarily a food and nutrition issue, but it's related that with Meals on Wheels, it's also the social contact that people have. And I've delivered Meals on Wheels in suburban areas and rural areas. And when we take the meals, it's often the only contact that people have. So with this sort of epidemic of loneliness and isolation, it really serves that role as well. So there is a piece of legislation that I introduced with my wonderful colleague Andrea Salinas, also from Oregon. It's called the Senior Hunger Prevention Act, and that will make it easier for seniors and people with disabilities to access food assistance programs.
That's awesome to hear. And we here at Northwest very much understand and contribute to the importance of the Meals on Wheels program for our population. Um, Kind of moving into a little bit of healthcare, what are your plans to improve access to healthcare for vulnerable seniors and people with disabilities?
Well, I'll start by saying my view of the healthcare system after my years in Congress, but also in the state legislature, and also just living. Our healthcare system is too complicated, it's too expensive, and there's too many people left out. So I look at healthcare really as a human right, and our healthcare system is not really doing what it needs to do at this point. But until we can get to a place where everyone has access to affordable healthcare, some of the things that we are doing is working to lower the cost of prescription drugs. And I was very excited that we were able, through a bill called the Inflation Reduction Act, that's the bill that also has the $35 cap on insulin for Medicare beneficiaries, and also caps out of pocket costs for prescription drugs at $2,000 a year. To $2,000 sounds like a lot, but spread over a year and without that cap, prescription drug costs can just be astronomical. So, those are a couple of things to lower the cost. One of the things that was really encouraging too, when we passed the Inflation Reduction Act, and I mentioned that applies to people on Medicare. Well, the industry, I think they kind of saw the writing on the wall because they've been lowering costs for everyone. We're still not there at a place where everybody can afford insulin and prescription drug costs, but we're really making a difference there. Also, I talked about the importance of caregivers and reimbursement for in-home care. Our whole care economy is, I think, overlooked, and people who work in those really critical fields are underpaid. So we need to look at how do we support caregivers. They do such an important job in caring for people in home and in centers. And then also, I have my Elder Pride Act to help people receive culturally appropriate support. And I mentioned the LGBTQ population.
That's wonderful to hear. One thing you'd mentioned a little bit was your work with Medicare and Medicaid and prescription cost limitations. We also see some issues there with access to behavioral health.
Absolutely.
What are you planning to do to assure Oregon seniors and people with disabilities on Medicare and Medicaid have access to behavioral health services?
Well, thank you for that question. I just did a telephone town hall meeting the other night, and several calls were about behavioral health, including regarding seniors and also senior housing issues. So this is something that's on people's minds, and certainly the pandemic really created extra need with all the isolation and stress that people went through there. So I will always fight to protect, as I mentioned, Medicare, Medicaid, and Social Security. We need to support the cost of living increases to keep up with rising costs. And I support raising the cap too, so we know that Social Security will be there for generations to come. But with behavioral health care, we have we're supposed to have mental health parity, right? And that was something that not only the state worked on, but also the federal government as part of the Affordable Care Act. I wasn't there when it passed, but I certainly support that parity for behavioral health care as well as health care. And that one of my former colleagues in the legislature used to say the brain is part of the body. Behavioral health care, mental health care is health care. So we need to expand the behavioral health workforce. And my alma mater, University of Oregon, now has the Balmer Center, where they're focused on preparing people, especially in education, to work in the behavioral health field. But we need to make higher education more affordable so more people can go into these fields, because sadly, they don't pay a lot. And if somebody's strapped with the high cost of college with student loan debt, they aren't going to be able to work in these really critical fields. So we absolutely need to expand the workforce, as well as recognize that parity. It is so important to have that behavioral health care for seniors, for people with disabilities, for people in our communities.
I really appreciate you highlighting kind of the systemic issues there that contribute to that challenge. So, one final question. We've kind of talked through a lot of areas that can be challenges for seniors and people with disabilities in Oregon. One that's becoming increasingly challenging is access to housing due to constantly rising housing costs and an insufficient supply of accessible housing for people with disabilities. Well, what are you planning to do on a federal level to prioritize affordable and accessible housing?
I'm so glad you asked me that question, Monica, because housing is something that comes up everywhere. Sometimes people think that that's just an urban issue, and it's not. Wherever I am in Northwest Oregon, whether it be urban areas, suburban areas, rural, coastal, I hear that we need more affordable housing. And that's been true over several years. Wages have been going up, but they don't keep up with the increases in the cost of housing. So there's a lot that we can do working, and it's going to take all of us working together. It's not going to be solved just by the federal government or just by local government or just by state or even by government. It's going to have to be public-private partnerships. We need to build a lot more affordable housing, and we need to do it soon because we're having this sort of unprecedented housing crisis, and it affects seniors and people with disabilities at a higher rate. So I serve as a co-chair of the Congressional Caucus on Homelessness, where we're really encouraging the administration to invest in more affordable housing because that's how you solve the homelessness crisis. You have more affordable housing. And it's a little bit technical, but there's something called the low income housing tax credit. And that's what helps developers who are developing and building housing. It pencils out for them if they have this tax credit to have more affordable housing. We also want to work with Housing and Urban Development, HUD, our federal housing agency, to get them to support a lot more housing and really help us build a lot more housing, whether it be for people with vouchers, very low income. I have also been able to bring to Northwest Oregon more than $6 million, in fact, $6.25 million to add more than 300 units of affordable housing this Congress through congressionally directed funding. Also a big supporter of Habitat for Humanity and other programs that help people get into housing. So we have a housing shortage. We know that is particularly serious for seniors and people with disabilities. And we absolutely to have one of the things we absolutely need to have is more housing for people as they age, whether it be independent living, assisted living. We need to have and in-home care to help those seniors. I do want to mention my Project Turnkey Act that will help. And Oregon is doing this, but help turn old hotels and motels into affordable housing. And I talked with a senior out in Clatsop County who found a place to live on a Project Turnkey site after being scammed. So there's lots of opportunity out there. We just need to work together, local, state, federal, public, private, and get a lot more affordable housing. And it is related to the other question, Monica, that you asked me about healthcare. It's essential for people to have a safe place to live for their health, as mental health as well as their physical health.
A very important building block.
Indeed, it is.
Well, thank you so much. So for everyone watching, we've been visiting today with Suzanne Bonamici, who's the incumbent and Democratic candidate for U.S. Congressional District 1. Thank you so much, Ms. Bonamici, for joining us today for this interview.
My pleasure. Thank you very much.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and Disability Service Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, call 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for their production of the forum. Thank you for watching.